Hello, my name is Dr Jenna Charlton. I am the Impact Lead for Regional Charity North East Wellbeing and a Research Associate at Newcastle University. And I'm going to speak today about some recent work completed for the Child Health and Wellbeing Network, which was a review of the network's journey of integration and shared improvement approaches as delivered over the last 7 years. So to begin, I think it's important to reflect on the network's vision, as this provides a perfect context and foundation for the current review. That is the vision of organisations working together to provide better support for children across the North East and North Cumbria. Of course, this is of particular relevance across our region due to its positive impact on historically underserved communities and the fact that our integrated care system is the largest nationally, with the highest poverty levels outside of London and the highest growth rate of child poverty in the UK. So since 2018, the network has worked to achieve this vision of organisations working together through a journey of integration, which has involved the delivery of the National Children and Young People's Transformation Programme, an integration pilot programme which established the North East North Cumbria Children and Young People's Centre for Integrated Care, which closed in March this year after 4 years of NHS England funding, and a broader programme of work based around locally determined priorities. So these work streams have aimed to connect multidisciplinary organisations working across the system of care, including primary and secondary healthcare, education, VCSE organisations and local authority teams, as well as children, young people and families. The network's approach to integration was aligned to recognised engagement and improvement models, and that includes 5 system-wide principles for shared improvement approaches and integration, developed by the Q Community, NHS Confederation and the Health Foundation. These 5 principles are defining scope and goals together, so bringing every voice to the table, building relationships and trust, so connecting with those outside the NHS and those who have had less engagement and support in improvement, diverse expertise as an asset, so recognising that every role has value, developing shared leadership across every level of the system, and using an improvement mindset, so having a clear shared idea of what you want to achieve and trying out different things and learning from these. The integration journey of the network has, however, been delivered in a context of great change, with staff reductions, financial pressures, and increasing clinical demands, meaning constraints on time, capacity, and people's flexibility to work across boundaries. These challenges are evident not only within the NHS, but system-wide, so many are feeling the pressures of change whilst striving to improve support for children and families. Now, in May 2025, the network and the ICB find itself on the precipice of further change, as the Secretary of State has asked ICBs to become pioneers of reform and evolve commissioning from traditional models that involve transactional contracting with individual providers to strategic commissioning, driving 3 shifts for health services, from hospital to community, illness to prevention, and analogue to digital. So, with such reform on the immediate horizon, there is a need to capture and understand the network's journey so far, exploring how successful the network's integration work has been, how the integration work may be harnessed, leveraged, and adapted to continue to support system-wide improvements, and how the experiences and learning of the network can support the transition to strategic commissioning, supporting a reformed future and renewed shared vision across multi-sector organisations, individuals and communities across the region. The Impact Hub of Regional Charity North East Wellbeing carried out a rapid review of the network's journey of integration over the course of 3 months, so February to April this year, with the aim of exploring the degree to which The 5 system-wide principles for shared improvement approaches and integration have been met by network activities and outputs. And these activities and outputs include governance and leadership infrastructures, programs, projects and partnership initiatives, websites, events, reports, documents and presentations, and awards. In addition, the review aimed to explore the integration experiences of key stakeholders within the network, identify barriers and enablers for system-wide integration, identify some top tips which serve as recommendations for supporting further integration across the system, and explore how the lessons learned from the integration journey and the network's mechanisms for integration can support a future transition to strategic commissioning. The methods chosen for the review were those that were most appropriate for the short time frame in which it was carried out and to cover the volume of work. So they are designed to provide a rapid overview of the integration activities of the network to inform learning. We carried out a desktop review with the aim of collating the activities and outputs of the work streams that have been achieved over the 7-year integration period, and understanding the degree to which these evidenced system-wide integration. Each activity or output was coded against the 5 principles for successful integration of health systems to indicate whether they did or did not evidence each principle. This categorization then informed a narrative synthesis of evidence for each principle. In addition, a short questionnaire was designed to capture the integration experiences and opinions of key stakeholders within the network, supplementing those more concrete network activities and outputs. The questionnaire included 3 key questions. What has worked well, i.e. the key drivers, enablers to support the integration of services and activities within the children and young people's system? What has been a challenge and barrier for integration? And what has been your own experience of integration? How has this affected your role? The 26 overarching network activities were reviewed for evidence of system-wide principles for integration. Within each of these, a number of reports, documents, presentations, etc. were reviewed. All of these 26 activities met principles for integration. 3/4 of them, around 76%, met all 5 principles, despite varying in purpose, aims, formats, and outputs. 16% met 4 out of 5 principles, and 8% met 3 out of 5. This infographic displays the degree to which each of the 5 principles were met by network activities and outputs. The largest proportion of evidence was for building relationships and trust and diverse expertise as an asset. So both of these principles were evidenced across 100% of network activities and outputs, representing the network's strong sense of connection and togetherness, creating opportunities for collaboration with those outside the NHS, and showcasing the network's upheld values of equality and inclusivity and the opportunity to learn from each other. Defining scope and goals together was evidenced across 92% of activities and outputs, and this demonstrates the foundation of implementation science upon which the network was built, i.e. having a clear, shared idea of what the network wanted to achieve. And use and improvement mindset was evidenced across 89%, demonstrating the learning culture that is subsequently woven throughout the network activities. Finally, developing shared system leadership was evidenced across 85% of activities and outputs. The strongest evidence for this principle is in the network's clear governance and leadership infrastructures, which model shared system leadership that then filters into the projects and programs, for example, in the form of shared system steering groups, core leadership groups, and terms of reference documentation. We can then look a little bit more closely at the evidence for each individual principle. I won't talk about every one of these in the interest of time, but as an example, for principle 1, defining scope and goals together, The governance and leadership structure of the network has been a fundamental mechanism for bringing every voice to the table and allowing the scope and goals of the network to be defined collaboratively. The network's vision, commitments, and priorities were defined through a structured series of engagements with children, young people, and the adults who work with them across all sectors. And the voices of children and young people continue to play a central role in defining the scope and goals of the network and of work streams across the system. This has been facilitated by the Young Advisors, who are the youth board for the network. In 2021, the network launched its Facts of Life publication, which pulled together data from across the region relating to network priorities, and the sharing of this data provided a common purpose for regional organisations, communicating shared goals to work towards, and helping to grow region-wide network membership. Across each of the integration programmes of the Integration Centre, there are examples of how the scope of work streams and goals have been co-defined. For example, Beat Asthma and Zone Borough Social Prescribing engaged in listening to children, families and local professionals to co-develop their programmes. And in a similar vein, the goals and objectives of the Integrated Health Hub in Schools programmes were set collaboratively after consultation with children, young people and the local system. Evidence for Principle 2, Building Relationships and Trust. The network brings together multidisciplinary organisations working across the system, so its reach extends beyond those working within the NHS to include VCSE organisations, schools and education, local authority and commissioning services, as well as the voices of children and young people and local communities. This connection and reach are purposeful and intentional by the network, and there are a lot of examples of how the network has actively sought to make new connections and build relationships and trust. For example, network huddles are a key mechanism that connects multidisciplinary colleagues around a common topic of interest, working to build those relationships and trust via shared learning and open communication. To date, 26 huddles have been held with attendance figures showing consistent growth over time. An example of how the network has sought to build a relationship with the education sector is the Collaborative Health and Care Research and Education project, a key focus of which was the fostering of relationships, strategies and support networks between health, education, voluntary and research sectors. The creative health workstream of the network has supported relationships between creative arts and VCSE organisations and education. For example, the Chris Drinkwater Creative Health in Primary Schools Award celebrates creative health projects in schools that involve collaboration with an artist or an arts organisation. The principle of diverse expertise as an asset is modelled by the network's governance and leadership structures, and this filters down to its advisors and membership, and within each of these a variety of roles and backgrounds are represented, as well as the voices of children, young people and their families. And to date, the network has 2,159 members. There are also many examples within specific work streams of diverse expertise supporting region-wide focus. For example, a digital marketing apprentice based within Any Youth supported the Tackling Inequalities in Children initiative. Try Life TV Research and Innovative Film Project is a multi-sector project which includes a strong focus on the voices of young people. The 2020 Impact Report laid out the network's plan to achieve its vision and priorities, highlighting that learning from others was a key enabler for achieving this vision. Principle 4, developing shared system leadership. The strategic oversight group of the network outlined its intended network membership at inception to ensure that all levels of the system were represented and to support shared system leadership. So this included the voice of children and young people, ensuring links across ICB governance structures, links across the breadth of expertise across system-wide professionals and focus areas. The Strategic Engagement Group also actively supports the collaborative delivery of engagement and communication activity for the network, bringing together stakeholders from different parts of the system to share knowledge, intelligence, learning, and best practice in a community of practice style. Supplementing this, outputs such as the network's Facts of Life publication and Core 20+5 framework that include accessible region-wide data have been catalysts to growing that shared system leadership, as all sectors can then lead on projects informed by the same underlying data. Many of the partnership programs, such as the Borough and the Asthma Programme, have developed shared system leadership with key named colleagues and clear roles and responsibilities. So there are many examples of cross-sector steering groups and core leadership groups leading projects like these. However, there are a couple of challenges to remain mindful of within developing shared system leadership. There is a need for better support for the integration of primary care services with acute secondary care services, and ensuring good engagement from clinical leaders remains, given the huge pressures within the NHS, as well as system-wide capacity challenges. Finally, Principle 5, use an improvement mindset, is the foundation of the network, which was instilled at the system transformation programme that original core network leaders attended at the network's inception. This meant that improvement science was embedded in activities to ensure that quality improvement efforts are evidence-based. The principle of using an improvement mindset is also modelled in the operating model for the network's Centre for Integrated Care, which is built on the premise of enabling innovations to have that space to grow and to learn. And this is evidenced in the network's platforms and opportunities to share good practice, such as huddles, lunch and learn sessions, and making publications openly available and accessible to everyone. But in addition, research and evaluation also features heavily across the network's projects, programs, and publications. Cutting across these principles are key barriers and enablers for shared improvement and integration. Key barriers to the integration work of the network have all been symptoms of working in that context of great change, with staff reductions, financial pressures, and increasing clinical demands meaning limited time and flexibility. So the ability to zoom out or to adapt practice to work across boundaries becomes more challenging. Enablers may be divided into those that are relational and those that are operational. Relational enablers include values and principles that support connection with people, whereas operational enablers include resources and activities that support efficiency. These enablers for integration that exist already within the network may, however, be leveraged to overcome those system-wide barriers. And in the final report, we will provide some explicit links between these barriers and enablers. But for example, lack of time and capacity can be addressed through nurturing relationships and trust, modelling integrated working, protocols and systems, and ensuring clear roles and responsibilities. Funding challenges may be addressed through data sharing, collaborative commissioning and nurturing relationships so that incentives are aligned, competition is reduced and resources are pooled. We also have some top tips for further supporting integration, which are based on relational enablers on the left here and operational enablers on the right. These are summarised here from the main report, just to give an overview of some key messages. A key relational enabler for integration is nurturing those relationships and trust, because an effective and functional collaborative relationship should serve to grow capacity and well-being through shared understanding, clear communication, clear roles and responsibilities, and mutual respect. A key operational enabler is shared system governance and leadership, especially in times of change. So including multi-sector organisations, diversity of expertise, as well as children, young people and their parents and carers, offers the opportunity for increased capacity and resource, empowers individuals and organisations, and promotes unity and common purpose. Also, using a framework for integration, such as the principles included in this review, means that progress can be audited and monitored long term, and there are clear shared goals to work towards. The NHS Confederation has outlined the enablers required for the transition to strategic commissioning, against which we can begin to map how the learning and experience of the network can provide support for the implementation of these enablers. This mapping is summarised here with further detail in the main report, but this table begins to paint a picture of how enablers that exist within the network can directly support the enablers required for strategic commissioning. For example, assessing population needs and defining outcomes can be supported by the population health management approach that is evident in the network's projects, as well as their knowledge of health inequalities and opportunities for stakeholder engagement. Relationships and trust play a large part in supporting the enablers for strategic commissioning, as these mean the network is well placed to communicate renewed shared vision and accountability across the system, to offer stability in times of change, as well as identifying those barriers and enablers for strategic commissioning that exist across the whole system. And the learning and experience from established governance and leadership structures can support oversight, accountability, and performance management. But are we there yet? It is clear that the network has made great progress towards system-wide integration across the region already, and that a wealth of experience and learning has been gathered along the journey of integration. But challenges to integration are not easily fixed and will take time to be overcome. In particular, we need to be mindful that there is still a need to further support the integration of primary care services with acute secondary care services, and to continue to ensure good engagement from clinical leaders given the huge pressures that exist within the NHS and across the system. However, the network does hold enablers that can work towards overcoming these challenges, and this will be particularly important for strategic commissioning, within which integration is at the very heart. This transition will require extensive ongoing support for individuals and organisations. Looking ahead, the network now must learn to harness their experience and expertise to benefit future integration, but a key mechanism for further work will of course be having the appropriate funding to continue to facilitate shared improvement approaches and integration of services across the region, to enable the network to realise its vision and to enable children and young people to flourish and reach their full potential. Thank you.